If your doctor has been unable to resolve your or your loved one's condition, please leave us a comment with a brief description. We will get back to you with current research information. Intestinal obstruction. An intestinal obstruction could be a medical emergency. An intestinal obstruction occurs when food or stool cannot move through the intestines. The obstruction can be complete or partial. There are many causes. The most common are adhesions, hernias, cancers, and certain medicines. Symptoms include severe abdominal pain or cramping, vomiting, bloating, loud bowel sounds, swelling of the abdomen, inability to pass gas, and constipation. An intestinal obstruction could be a medical emergency. A complete intestinal obstruction often requires surgery. Causes. The most common causes of intestinal obstruction in adults are intestinal adhesions, which are bands of fibrous tissue in the abdominal cavity that can form after abdominal or pelvic surgery. Hernias, which are portions of intestine that protrude into another part of your body. Colon cancer. And intussusception. In children, the most common cause of intestinal obstruction is telescoping of the intestine, called intussusception. Other possible causes of intestinal obstruction include inflammatory bowel diseases, such as Crohn's disease. Diverticulitis, a condition in which small, bulging pouches, diverticula, in the digestive tract become inflamed or infected. Twisting of the colon, called volvulus. Impacted feces. And pseudoobstruction. Intestinal pseudoobstruction, or a paralytic ileus, can cause signs and symptoms of intestinal obstruction, but it doesn't involve a physical blockage. In paralytic ileus, muscle or nerve problems disrupt the normal coordinated muscle contractions of the intestines, slowing or stopping the movement of food and fluid through the digestive system. Paralytic ileus can affect any part of the intestine. Causes of paralytic ileus can include abdominal or pelvic surgery, infection, certain medications that affect muscles and nerves, including antidepressants and opioids, and muscle and nerve disorders, such as Parkinson's disease. Risk factors. Diseases and conditions that can increase your risk of intestinal obstruction include abdominal or pelvic surgery, which often causes adhesions. A common intestinal obstruction. Crohn's disease, which can cause the intestine's walls to thicken, narrowing the passageway. And cancer in your abdomen. Complications. Untreated, intestinal obstruction can cause serious, life-threatening complications, including tissue death. Intestinal obstruction can cut off the blood supply to part of your intestine. Lack of blood causes the intestinal wall to die. Tissue death can result in a tear or perforation in the intestinal wall, which can lead to infection. Infection. Peritonitis is the medical term for infection in the abdominal cavity. It's a life-threatening condition that requires immediate medical and often surgical attention. We hope you have found this information valuable. If you enjoy these videos and want to support us being able to continue creating content for many years to come, we'd love for you to consider becoming a patron of Converged Medical Research. The link for becoming a patron is in the description below. We have many other sessions on medical-related topics coming. If you need information on a particular topic, please leave a comment below. Please click the subscribe button and ring the bell.